8 years, and it seems like I cannot avoid looking at this. As much as I try to look at all these other things, I always come back to the fact that I have to look at the foods that people are eating and the environment that they live in, because it directly impacts their health and their illness. So hopefully after this is done, you guys will get a sense of how to evaluate someone from that standpoint. Oops, let me see if I can go ahead and move this along. I'm not being able to advance the slide presentation.
Let me give her back to you real quick. There you go. Sorry about that.
Okay, seems like when I hit my arrow to move forward, it doesn't seem to want to do anything, so I'm not sure why it's not advancing.
I'll advance the slide for you. How about that?
Okay.
There we go.
I'm happy to do it if I knew how to.
Oh, there you go.
Maybe that's it. Okay, there we go. So the objectives, you want to understand historical basis of food allergies and illness. I'll give you a little bit of history of what I learned when I belonged to the American Academy of Environmental Medicine and went to their conference there. Common signs and symptoms to look for, diagnostic valuation of food allergies, food intolerances, and other environmental exposures that might be causing some cascading inflammatory reaction in the body. Integrative therapies to manage and treat allergies and lower future risk of disease, and understanding how the GI tract, gastrointestinal tract, can play a role in making things worse and can make things better too, and how to restore it using the 4R program. Okay, historical perspective. I found it very interesting, and I always do find it very interesting, how we kind of begun to understand the connection between our environment and ourselves. And Dr. Theron Randolph, who was originally a psychiatrist and found that psychiatry was not the best way that he can help people, he ultimately got training to become an allergist immunologist, and he literally said that, you know, everybody's illness in the world is connected to some kind of an allergic or some kind of a reaction to something in their environment, whether it be food or whether it be chemicals. But he kind of made that observation early on in the 1940s, and he really was a pioneer who helped connect environmental elements, including foods, to underlying chronic illness. And he realized that when people eat common foods regularly, they caused acquired unwanted symptoms and illness. And so the more commonly eaten foods or commonly consumed beverages or common exposures, the worse people got. And he taught patients how to avoid intolerant foods to alleviate unwanted symptoms. I'm not sure how to advance this. I don't think I have control over this, so next slide, please.
Sorry about that. Well, there we go.
I'm going in and out of having control, so I don't know why.
Yeah.
There we go.
Yeah, we had an issue on our side that we had to change real quick, so sorry about that.
That's okay. And Daniel, there's a repetitive ringing sound, and I'm not sure if that's normal or not, but like a ring. And is that part of this process?
I think it's normal. I'm not quite sure how to get rid of it. It's part of people logging in and out of the audio.
Oh, got it. Okay, very good. I apologize. Okay, so the historical perspective some more. Dr. Randolph in 1949, against many of his medical colleagues' viewpoints, unsuccessfully testified at the FDA hearing on bread that all food ingredients should be listed on labels of processed food products. He did not succeed, and it took a lot longer for us to actually see nutritional ingredients on products. It's interesting to me how long ago that was an issue. In 1951, he stated that man's increasing pollution of the environment with chemicals was a major source of illness, and yet still it wasn't really incorporated into the medical dogma and an important aspect of taking care of patients. And he created the approach of investigating environmental causes of a patient's illness, then treating the problem by eliminating them. He was very successful at doing that, as long as the patient went along and did everything he recommended. Dr. Randolph created the Society for Clinical Ecology back in 1965, and it was renamed the American Academy of Environmental Medicine in 1988, and still exists. And I don't know how many members they have, but they have thousands of members nationwide and internationally. And he taught that the more symptoms a patient has, the more likely he or she is to be suffering from an environmentally induced disease. Next slide, please. Oh, there it is. Okay. Thank you. So some common considerations. Usually both the patient and the doctor have not suspected a food allergy or intolerance as the root of their problem, because most of the food allergies or intolerances are a delayed reaction in the body, and they're masked and they're hidden. So when you meet with the patient, like I commonly do, I ask them, do you have any known allergens? And most of the time they'll say no, or they may say, yes, I have hay fever with grass or with ragweed. And I ask them, do you have any intolerance to certain foods? And they say, none that I know of. And so that really doesn't help me as far as determining whether or not they truly have an underlying food intolerance. It just tells me that the patient is not aware that they have anything, and we need to further investigate it. So patients who consume their allergic or intolerant foods regularly often have chronic ongoing symptoms, and therefore it makes it very difficult to identify what causes what, because they're basically consuming something so regularly that these symptoms pop up all the time, and maybe not so consistently with the food that causes it, because you can have up to a 3 to 4 day delay in having a manifestation of a symptom. Avoiding the problematic food often causes withdrawal symptoms, possibly looking like an acute allergy attack at that time. So people often will consume an offending food on a maintenance basis to avoid these worsening of symptoms. And this is absolutely true, and I learned this in functional medicine as well, that when you try to eliminate a food, the first 5 days are extremely challenging, because you're going to have withdrawal symptoms, you're going to have worsening of symptoms, and then all of a sudden, after about 5 or 6 days of not having that offending food, things start to clear up. But it's during that window period that people oftentimes will consume their repetitive use of foods, and therefore they continually have these ongoing intermittent symptoms. Next slide, please. Okay, if foods are eaten more than every 4 days, they are good candidates for acquiring a food allergy or food intolerance. And my understanding of this, at least all the times that I've reviewed why 4 days is such a golden number, is that it literally takes about 4 days for you to consume a food, to process that food, and to eliminate that food. So that's where that 4 days comes from. It just takes that long to travel through the body. So we'll talk a little bit more about the importance of a rotational diet that is every 4 days later on in the talk. Common foods often cause food allergies and or food intolerances, and these would include such things as cow's milk products, eggs, wheat/gluten products. So it doesn't have to be just the wheat grain, but it can be any relative grain that has gluten in it. So barley and rye and spelt, and even oats to some degree if oats are contaminated in a manufacturing plant that uses wheat. And nowadays you can actually see that on the packaging. Soy, corn, yeast, and coffee. So those are common foods that I see in my practice that can cause unwanted intolerances and allergies. And by avoiding these offending foods for a couple of months, people can often reintroduce the food every 4 days without much problem. Next slide, please. And Daniel, if there's any other way that I can do that for you, just let me know. Okay, so sensitivities, not just foods. So foods that cause allergic reactions and or intolerances are often hidden as ingredients in commercial foods. So it's very important, if you're going to start to eliminating a food, that you educate people how to read labels and how to find food products that don't have their offending food as an ingredient. So, you know, as you start looking at ingredients on food packaging, the ones that are higher up on the list are more abundant, and the ones that are lower on the list are less abundant. But I usually encourage people to find products that don't have any of that food in it. So if it's a cow's milk product, they want to stay away from whey and casein, and they want to stay, if they're soy intolerant, they want to stay from any soy product. If they're egg intolerant, egg is oftentimes a common ingredient. So you just have to educate them how to avoid those things. Many modern foods, as well as medicinal drugs, contain preservatives, additives, stabilizers, artificial colorings, and flavorings. So when you're with a patient in the room, you want to talk to them about some over-the-counter supplements, any food products that have added preservatives or additives. Any medications that they're currently taking might have some ingredients in there that might actually be allergenic as well. And some scientists believe that increased chemical pollution in our air, in our water, and our food is to blame for a lot of the sensitivities that we have in our world today. And it seems to me that every single patient I speak to in my consultation talks about how more sensitive they're becoming to the world. They would say things like, you know, when I was younger I didn't have any allergy problems, but it seems as I get older I'm becoming more and more sensitive to my environment. And to me, obviously, that definitely indicates that I need to look at that more closely. I oftentimes suspect underlying toxic exposures from chemicals, and that their body just has a certain amount of toxic burden that I'm going to need to work on, and they may be very good candidates for a detoxification program. But along the way, I absolutely talk to them about the process of looking at food allergies and or intolerances to things to see if maybe that's a problem. And then foods can easily become contaminated by the use of insecticides in farming and mold. And molds are also very commonly a contaminant in foods. And I always suspect peanuts, because that happens to be a nut that typically does have mold as a contaminant. But you don't have to wait until a food product has that green fluffy mold on it before it actually has been contaminated with mold. It has it even before then. So lots of foods that we consume have that mold contaminant to it. Next slide, please.
I think you have control now.
I have control. Great.
There you go.
Those little arrows disappear on me, then I don't know what to do.
Yeah, it's basically what happens if I move my mouse by accident, it defaults to me. If you move yours, it'll go back. So,
okay.
You're in good shape.
Thank you. Okay, just a quick review. Immunology from medical school, the Jelen-Coombs hypersensitivity classification scale. You've got the type 1 reaction, which is the anaphylactic reaction, where you have on the mast cells these IgE antibodies that are basically sitting there with their little arms open, and they're just waiting for the antigen to sit right on top to cross-link the IgEs. And when they do, they basically cause release of all of these vasoactive substances and amines and mediators and cytokines that basically causes a massive release of these chemicals that really cause anaphylaxis in somebody and could be life-threatening for them. This is extremely rare, but it is a very important pathway of hypersensitivity. You have the type 2, which is a cytotoxic, where you form your IgG and your IgMs. They bind to the antigen. And then that's sitting on the target cell surface, and then they get phagocytosed into the cell to get broken up or lysed by that target cell. And it's an antibody-dependent cellular cytotoxicity, so you need these IgG and IgM antibodies to bring that antigen in so that the cell can go ahead and take care of the process. Type 3 is the immune complex, where you've got these antibodies floating around freely in the blood. And then they bind to the antigen, and you have these antibody-antigen complexes floating around. And then the neutrophils see them, they capture them, and they engulf them in their lysosomes, and then they go ahead and destroy it that way. And then you have the type 4, which is cell-mediated or delayed hypersensitivity, where the thymus-derived T cells are responsible for releasing cytokines, and they cause a T cell-mediated cytotoxicity. And again, this process can happen along a certain cascade of processes, and it can also be a delayed reaction, and that's why it's called the delayed hypersensitivity. Okay. Oh, I think I went too fast. Okay. IgE-mediated food allergies, these usually happen immediately or up to 3 hours after exposure. This is what commonly gets done at the allergist office when they are being administered a test on their backs. They've got these pinpricks, and they watch you for up to about an hour, 2 hours to see if you have any kind of a wheal formation, and then they measure that to determine your reaction. So that would be an IgE-mediated reaction. It happens in less than 5% of the population, and this would be classified as a true food allergy. And to me, I don't think you need to run and tell all these people to run to the allergist to be tested, because you can ask the patient, when you eat a certain food, do you have an immediate reaction to it? And patients will usually tell you this information, especially people who have a peanut allergy, or they have a milk allergy, or they have an egg allergy. They'll say within 30 minutes of eating an offending food, I develop a significant rash on my face, or I notice I have tremendous itching in my mouth, or I notice my tongue swell, or my breathing changes. So I don't feel like I need to really do a full panel of IgE-mediated reaction tests for them, because they usually give me that information, or they already know it when they walk in to see me. And this type of reaction causes symptoms such as hives, diarrhea, stomach cramping, wheezing, tongue swelling, difficulty breathing, and or anaphylaxis. Oh goodness, I'm not sure where that came from. Okay, so the skin tests that you can do for this are intradermal, prick test, or patch test, and it's the reaction of the skin to different substances. The RAS test, which is the most common test that you see at allergist offices, the radioallergo sorbent test, is a finger prick, in vitro blood serum testing the amount of IgE antibodies reacting to specific allergens. So this is where they collect a little bit of blood and they send it off and they check it to see if there's any IgE reaction to these exposed antigens, whether it be grass or weeds or inhalants or some kind of a food product. There we go. Okay, delayed hypersensitivity, this would be the IgG-mediated response. This occurs hours, even days after exposure. It affects about 80% of the population. The production of IgG antibodies involving a complex series of reactions which triggers the complement cascade. And there's a release of inflammatory cytokines which leads to the final destruction of whatever got into the system that initiated this by cell lysis. So again, it's like a cascading event, but it's mediated by the IgG antibody. And that's important to know because when you do IgG testing, you are looking for the IgG reaction. And ELISA, or EIA, is a very common way of doing this. And you're looking for the presence of IgG antibodies in patients to these food antigens. And you're basically, you have all this trays of fluid in there, and you're basically adding to this fluid the antigen. So let's just say it's wheat, or it's gliadin, or it's gluten, or it's casein. You're basically adding them, and you're looking to see if that antigen binds to an IgG antibody that's in there. And if it does, it causes a color change. And the color change can either be a slight color change, which would be a mild reaction, or it could be a deep color change, which would be a very significant reaction, and it will literally be labeled as such when you get your results back. And these patients can usually have this done in the office. They get a pinprick on the finger to get maybe 5 or 6 drops of blood, and you process it here in your office, and then you send it in the mail, and you get the results back a couple weeks later. So this is to see if they have an IgG reaction, allergic reaction to their food, or what we call a delayed reaction to their food. Now, that is very important when you're taking a look at whether or not a food is causing an allergic reaction in somebody. But it doesn't look at whether a person has an intolerance to this food. And this chart is really demonstrating the difference. If they have a specific allergy, it's a specific immunity to that particular food antigen or chemical antigen. They have a genetic exposure, possibly. They might have a history of atopy or eczema or asthma in the family, or food allergies in the family. They have an immediate symptom onset at times. It can be IgE-mediated through the mast cells and basophils. It could also be the delayed reaction with the IgGs. And then you usually can test for it in a skin test or RAS test, or you can do that ELISA testing for the IgG component that we just talked about. The intolerance is when you consume a food, you activate a whole cascade of inflammation, but it's not through an antibody. It's not through an IgE or an IgG. It's actually through a cascade of white blood cell morphological changes and cytokine release and maybe activation of your complement pathway. And that's what an intolerance may be from. Another reason why the intolerance might happen is because you have such significant gastrointestinal damage that these food particles that are coming down are not being digested properly. They're causing an unwanted reaction in the intestines. The intestinal lining may be damaged, so things are passing through. So if we repaired the intestinal system and the gastric area, these things would probably work fine, but we need to repair that in order to remove some of the intolerance. So delayed symptom onset, often days. You can have innate immunity. You can have this innate immunity is through the T-cell pathway. You can have genetic exposures also. And another thing is it may not be genetic, but it could be an environmental common denominator. So you may have somebody who's been raised in parts of Chicago, which are environmentally very polluted. The south side of Chicago is a common example. That area, the way that the winds blow there, tend to recruit more of the pollution. And so people who are raised there, generation after generation, have been exposed to the same pollutants over and over again. So it's not so much a genetic problem as much as it is a common environmental exposure. So I always ask people where they were raised, where they spent most of their time, if they were by farmland, if they were by industrial plants, if they had any occupational exposures. Those are all very important to me. So the gut integrity can be a factor. The enzymes inside your digestive system in your stomach and in your small intestine, there may be deficiencies, so you're not properly breaking down foods, which would cause a cascade of inflammation and intolerance. And then you could have that toxic load that we talked about, that when you have too much toxic burden, that all of a sudden the immune system just does not behave normally at all. So signs and symptoms of allergy. You can have localized allergic symptoms such as sneezing, runny nose, stuffy nose, postnasal drip, clearing of your throat, cough, wheeze, asthma, itching, gas, diarrhea, constipation, eye or ear symptoms. Those would be more localized symptoms. And you can have more systemic symptoms such as fatigue, depression, headache, body aches, swelling, hypertension, bleeding and bruising, unusual rash, or cognitive impairment. This list is by no means a limited list. I can tell you that in my short duration of doing the type of practice I have, I can say that I have seen just about every symptom come from a food allergy and or intolerance. And there's usually multifactorial reasons for it, and their intestinal systems are usually damaged, and they're lacking enzymes, they're lacking some good flora in their intestinal tract. So it's really peeling away the different layers for this patient that's going to get them well, but this is a very important aspect of doing a proper evaluation for them. You can have hyperactivity, irritability, hunger, thirst, sweating, flushing. You can have aggressive behaviors, anxious, fearful, panic. In my pediatric population, I do a lot of food allergy and intolerance testing for children who come to see me for behavioral disorders, ADD, ADHD, mild autism, OCD, those kinds of things, because I oftentimes uncover that they have some intolerant foods, and I get rid of their intolerant foods. I partner with the parents, and they set up a 3-month follow-up, and they're new children. They are completely different children, no longer needing medications. They're doing well in school. They're doing well with their social skills. It's really a wonderful thing to be able to see that. So if you happen to see children in your practice, factor this evaluation in. And of note, common environmental chemicals can cause same above symptoms, signs and symptoms as food allergies and or intolerances. So the evaluation, you want to get a detailed history. That is key to uncovering underlying allergies and or intolerances. Questions should include, when did you last feel optimally well? That will usually give you a time period in their life when things started to go from well to unwell. What kinds of foods do you eat regularly? And when I say regularly, I tell them, what kind of foods do you eat more often than every 2 days? And I just say, give me an example of what a typical day of eating is for you. I ask them where they were born and raised to get a sense of what kind of environmental exposures they've had, what kind of toxic burden they may have. I ask if they've had any unwanted symptoms with certain foods, and if they've had any childhood illnesses, if their immune system has been compromised for a long time, and any gastrointestinal symptoms. I always ask them if they have a regular bowel movement every day, if it's normal, if it's difficult, if it's diarrhea. Do they have gas, bloating, cramping? Do they have really bad breath all the time? Do they have bad gums? Those kinds of things to kind of give me an idea of whether or not their gastrointestinal tract is working for them. Physical examination may or may not show allergic involvement when you see them. They may be in a state of kind of a dormancy, so to speak, or it's just not presenting itself as a symptom, or sometimes you can see signs like venous congestion under the eyes. You look inside their nose, and their sinus passageways look red, and they look swollen, and there's clear discharge. And you look in the back of their throat, and they've got what they call a cobblestoning, where you've got this kind of bumpy, reddish texture in the back from chronic postnasal drainage. They may have enlarged tonsils, and the tonsils are part of your lymphatic system, so they may be chronically stimulating their immune system. So those are things that I take a look at. And abdominally, they may have some mild diffuse tenderness on palpation, and it might be a little bit worse underneath their right upper side where their liver is. So these are little things that I usually take note of. If they have a little bit of swelling in their lower extremities, or if they have tenderness in their joints, I'm obviously thinking inflammation. There's some inflammation going on in their body, and I need to find out what the source of the inflammation is from. I review prior labs and testing, especially if allergy testing was already done before. I look at delayed food allergy testing as an option for them because it's simple, it's an affordable way to check for underlying food allergies. I also take a look at doing some intolerance testing, and so there's different companies that I can use, and I'm noticing that there's a misspelled there. Sorry about that. But basically, I'm looking to see if these people would be good candidates to look for delayed IgG food allergy testing and or food intolerance testing. So one of the tests that I have been using quite frequently is the ALCAT test. And one thing that I was impressed with, prior to using ALCAT, I was very commonly using IgG delayed ELISA testing, and I used a couple different companies to do that. One of them is called US Biotech. And what I was realizing when I got these results back is I did think that they were very helpful, because if they were positive, moderately positive, or stronger than moderately positive, I did absolutely eliminate those from my patient's diet, and they did get better to some degree. But some of them would come back to me and say, I'm still not 100% better. I think we're still missing something. So I was pleased to find ALCAT and to understand how they do their testing, because it was completely different. They basically combine the blood with, you send the patient to Westcliff Labs, that's what I do here, and they do a lab draw, and they send several tubes of blood, and ALCAT gets this test, and they combine the blood with the food, chemical, and or drug test agent that you're trying to see if the patient has a reaction to. And you basically allow enough time for any kind of reaction to occur, the pathway to be triggered, and then you measure the white blood cell size and volume changes, or these morphological changes that are induced by the activation of this pathway. And you compare it, just like they do over here, you compare, say, their baseline to the change, and you're looking for the change, the distribution changes under the curve to determine what the reactive strength is. So it may be mild, moderate, or severe based on this difference here. So when you get, well, ALCAT gave me some very good information, which I thought was very useful for you guys to know about. They've done some of their own internal testing, and they found that it was 98% successful with weight loss. That was done out of Baylor Medical College. 83.4%, there was a correlation with double-blind oral challenges with food. So in other words, what they found on their test correlated 83.4% of the time that if they challenged somebody with that oral food, they got the same reaction, the same results. 96% correlation with double-blind placebo-controlled oral challenges with food additives, which I thought was great, and I wasn't really getting any kind of information back from my IgG testing regarding food additives. And Dr. Theron Randolph mentioned this in his book, that it may not be the food that's the problem. You can give somebody an organic peach, and they'll be fine. But if you give them a non-organic peach from the store, they have this tremendous reaction. So it has nothing to do with the peach itself. It has to do with everything that's been added to this peach. So I found that very interesting and something I needed to take a look at. And there's a 90% improvement with numerous conditions in 18,000 patients over 16 years. So there are a lot of people that have really benefited from getting ALCAT testing and following the recommended elimination diet and rotational diet. One of the studies that they did back in 1998 was looking at 353 consecutive patients following the ALCAT diet plan. So these are people that were ALCAT tested, and then they were they had a number of symptoms. You can see across here the different symptoms and how many people had them, and you can see that once they did their ALCAT testing and they followed it, you saw how many people had great symptom improvement. They had improvement, little or no improvement, worsening, and then lost to follow-up, which aren't that many. So you can see here total improvement for perennial rhinitis sinusitis, 95% of the patients, atopic eczema, 94%, urticaria, 83%. Across the board, you can see very high numbers of improvement. So these patients really did very, very well. And there's a small number of people that actually did worse, and these are probably people who I would imagine are severe, and before they get better, they may get worse. And I've seen that in my practice, too. And I tell patients that you may get worse before you get better, and I just prepare them for that. And you might need to do the same in your practice. So here is a short-term efficacy of the ALCAT test of food sensitivities to facilitate changes in body composition and self-reported disease symptoms. So this is a randomized control study, And this was done out of Baylor. And it looks like some other locations that were found in Texas as well. And they basically found that there was a highly significant improvement in body composition and self-reported disease symptoms. And 98% of those following the ALCAT plan either lost weight and or improved body composition. And there was a marked reduction in cravings in general, especially for the sweets. And I think that this is really important because there's so many companies coming out with this, quotes, magic bullet for weight control, and I think we can all agree that there's no magic bullet. There's always many, many factors when it comes to weight management. But what I can tell you is that removing intolerant foods and or intolerant chemicals or additives or environmental exposures has made a dramatic improvement in my practice. And I had a gentleman come to see me in January. He did the ALCAT testing in December when he found out that he already met his deductible and that his insurance would cover the cost of this test, which happens quite a bit. So he was able to get ALCAT tested, and the insurance was able to cover the cost for him. And he had a number of intolerant foods that we removed, and he came to see me about 6 weeks later for a follow-up, and I didn't even recognize him. I thought he had a haircut, and I said, "Did you cut your hair?" And he said, "No." And he said, "Well, I'm 22 pounds lighter." And in 6 weeks of following the ALCAT program, he lost 22 pounds. Now, that may not be typical, but he says, "I've only done the changes that you recommended. I haven't even incorporated an exercise program yet, which I want to do, but I feel fabulous." So I do have those kinds of changes happening in my practice on a regular basis, but we still need to continue along the path to get him 100% well. But he was very, very pleased with his weight loss in such a short time and feeling so much better. So when you get your results back, you're going to get a packet from ALCAT in the mail, and this is what it's going to look like. And it's categorized into 4 columns. Here's severe intolerance in red. Here is moderate intolerance in orange, mild intolerance in yellow, and the green is for go. These are considered to be non-reactive items. At the bottom here in the blue boxes, you have certain categories of yeast in the first box, specifically Candida. And then the next box, it's kind of small for me to read, but if I go by my memory, it's going to be gluten and gliadin and intolerance to certain grains from the gluten and gliadin families, and it'll tell you if it's mild, moderate, or severe. And then down here, again, I cannot remember off the top of my head, but it's another category. I think it has to do with...
It's casein and whey.
Casein and whey, okay.
Yeah.
Casein and whey, okay. Thank you. So you've got Candida or yeast concern, gluten and gliadin concern, and then you've got casein and whey, which are proteins that are found in cow's milk products. So they'll tell you in these 3 boxes if they're mild, moderate, or severe, and they'll even tell you which other related foods to avoid. So in this particular patient, they probably had some kind of reaction to gluten and gliadin, and they told them to avoid things like rye and spelt and oats. So it guides them which families that they should be avoiding. So when I look at this particular page, clearly the severely intolerant foods are the ones that you want to heavily work on, and I usually tell patients they need to really avoid these. You know, a lot of people say 60 days. 60 days is an eternity for some people, especially if these are foods they're eating all the time. So realistically, I tell people you want to try to avoid these at least 30 days, preferably 6 weeks, and if you can go to 2 months, great. And then with the moderate foods, I tell them for at least 30 days. And then with the mild foods, I usually tell them they can rotate these foods in once a week. And I believe ALCAT will recommend that they can rotate them about once every 4 days. But I usually encourage them to do it once a week because I actually don't want these mild foods to become more intolerant as time goes on. So I really caution them then not to be using them more than once a week. So you get more from your ALCAT packet besides that. You get an example of a rotational diet using the green column foods and using the mild intolerant foods. They actually give you a nice information packet of related family groups so that someone can know that if they're reactive to certain legume, a certain bean, let's say, that they should avoid some other types of beans that might cross-react. So the information is really very nicely presented in a nice notebook format, and the patient gets a copy and you get a copy, and you sit down and you make a follow-up appointment and you review it with the patient and you answer whatever questions they have. But they really have everything they need in that organized notebook. So you determine the health of the patient's gastrointestinal system, since this can be a part of the problem, which for my patients, I would say almost 100% of the time it's part of the problem. If the GI system is impaired, it must be restored back to normal in order for patients to fully recover and eliminate all their unwanted symptoms. So I wanted to give you just a little bit of information on how to do that. In the Institute for Functional Medicine, the IFM, they talk about the 4R program for gut repair. The 4 R's stand for remove, replace, reinoculate, and repair. So the first R, remove, you want to remove any kinds of intolerant items that are in the gastrointestinal tract. So that would include allergenic foods, anything you're intolerant to. It would include any kind of toxic burden that they may have in their bodies that are causing damage. If they're taking anti-inflammatories such as aspirin or ibuprofen, they need to remove those as well. So you want to consider an elimination diet to remove the unwanted foods, remove possible pathogens. So if they have bacteria or yeast or parasites, I usually do a comprehensive digestive stool analysis to look for that, and then I will give whatever they need. Whether sometimes they do need a prescription antifungal if they have a lot of yeast. They might need an antiparasitic. They might need an antibiotic to get rid of a certain bacteria. But I'll always try to look for more nutritious or natural ways so that I won't wipe out all of their good bacteria. But I do want to know what I'm treating before I get started. Reducing sugars and refined carbohydrates and saturated fats and red meats. These are all very important food items to remove because it's very difficult on the gastrointestinal tract. And restoring proper transit time, increasing dietary fiber, getting enough water. I can't tell you how many people don't drink enough water, and I'm probably guilty of that too. But you just want to make sure that things are moving along normally, at a normal pace. You want to replace what's missing. So enzymes, hydrochloric acid, betaine, bile salts, digestive herbs, all of these things we make less as time goes on, and our food has less natural enzymes in them because there's so many things that are added to our foods that that interfere with the body's, the plant's ability to make its own enzymes. So the end product is more deficient than it's ever been. So I usually put patients on digestive enzymes and some extra hydrochloric acid if it seems to be indicated. And one little thing that I do is when I get their blood test back and I look at their comprehensive metabolic panel, I look at their total protein, their albumin, their globulin, and their albumin-globulin ratio, and I also look at their BUN numbers. And if they're actually kind of on the lower side, and I get from the patient that they're eating adequate protein, that's kind of a little tool that I use to indicate that they're not absorbing proteins adequately. So that's something that you can start using your regular blood testing for, to see if they're maybe lacking some hydrochloric acid, which is essential to break down proteins and amino acids, and adding some digestive enzymes as well. Number 3, the third R is reinoculate. So you want to give friendly bacteria, and you also want to give some prebiotics. Prebiotics are basically the food sources for the good bacteria. So things like fructooligosaccharides, inulin, Saccharomyces boulardii. These are all things that help these bacteria proliferate. And there's many other favorable bacteria besides lactobacilli and bifidobacterium, but those are the very common ones, and there's different strains within those categories. And the fourth R is repair. Repair the mucosal lining with things like L-glutamine, essential fatty acids, zinc, vitamin B5, which is pantothenic acid, vitamin C, E and A, beta-carotene, N-acetylglucosamine, gamma-oryzanol, glycyrrhiza, which is licorice root, and aloe vera. You can consider extra antioxidants and extra minerals that are antioxidant-like, such as selenium and zinc. And Saccharomyces boulardii, which is down here, is important for healing, but it's also important as a prebiotic. And ginkgo biloba will improve circulation anywhere. It's not just for the brain, but it'll improve circulation in all the microvasculature, so that's why it's included here. And consider evaluation of their overall nutritional status. Make sure that they're eating everything that they need that's right for them, and also making sure they have like a comprehensive multivitamin and multiminerals, and make sure that their bodies are getting all those micronutrients that they need. So treatment. Once offending foods have been identified, patient will need to entirely eliminate moderate to highly reactive foods for at least 30 to 60 days. You really want to give people a lot of choices because this is a very difficult thing to do. So I really spend a lot of time when I follow up with them to give them lots of choices. I don't just hand them this folder and go, here, good luck. I really sit down and go, okay, what kind of foods do you like? What types of things on this list do you think you might want to purchase? And I even give them some ideas as far as cooking and recipes. And a lot of my patients will rely heavily on rice-based products when they're going on a gluten-free diet. And I tell them where to shop. Over here we have Henry's and Trader Joe's. You can go to Mother's. I'm sure, Sprouts. There's all kinds of stores that they can go to that have a better selection than the regular supermarkets. And you want to restore and repair the impaired gastrointestinal tract using the 4R program. You want to provide the body with proper nutrients to allow proper healing. And rotational diet involves eating specifically allowed foods only once every 4 days, and we talked about why 4 days, and leaving 1 full day between related foods in any of the same food families. So when you get your results back from ALCAT, you will have food families identified, so you can kind of say, okay, make sure that you don't eat these within the same day, or give yourself at least a full 24-hour break between these types of food family groups so that you don't develop a food intolerance to these, because these are usually acquired after eating them on a regular basis or eating them on a more frequent basis than what you should be doing. And then food families will be outlined in the ALCAT report as stated. And then just make sure that you answer people's questions, because if you don't answer their questions before they leave your office, they may walk away and just say, this is way too hard, I'm not going to do any of it. And they might get the sense of overwhelmed feeling and deprivation just before they even leave. So really kind of support them as best as you can and answer all their questions. You can reintroduce offending foods one at a time in small quantities every 4 days. So I usually say, okay, after this time period, I want you to select one of these foods, let's say in your severely intolerant list, that you really feel that you're going to miss and you're going to want to reintroduce. So let's just say it happens to be, I don't know, peanut butter. And I say, okay, if you're going to do peanut butter, then maybe give yourself maybe 1/4 teaspoon of peanut butter with the foods that you're not having problems with, and you want to wait at least 4 days before you try it again. And when you try it again, and if nothing happened with that small serving, then try a little bit larger serving and wait 4 days and see how you do. And I tell them to basically get up, kind of get a dose of like maybe up to about a teaspoon's worth of peanut butter every 4 days. And if they're doing fine with it, then they can move on to the next food. And they can tolerate that dose of peanut butter every 4 days, let's just say. So you find the dose of food that doesn't cause any symptoms. Titrate down allergy medications, since these are only masking underlying reactions and not taking away the main problem. So I usually encourage my patients they need to get rid of the Nasonex, the Flonase, the Claritin, the Benadryl, the Allegra, those kinds of things, because I really need to see how we're doing. I don't want them to rely on that because it doesn't get rid of the underlying cause. If offending foods cannot be entirely avoided, which happens a lot, add nutrients to blunt the reaction to the foods. So fish oils work really nicely for that because they're natural anti-inflammatory, and they tend to blunt some of the cytokine reactions. Oregano oil is really very helpful for people who might have a burden of bacteria or yeast or parasites in their intestinal tract. What I usually tell them to do is to add a couple of drops of oregano oil diluted in some water, and I have them add a little bit of xylitol sugar, because xylitol sugar happens to be a sweetener that is antimicrobial and antifungal. So I have them mix that up, and I have them use that in a spray and spray some in their sinuses if they're having sinus trouble, and I have them drink a little bit for their intestinal tract. And I've even had some of my female patients use it as a vaginal douche, because sometimes they have a lot of vaginal dysbiosis with different bacteria, and I have found that it works really well. Oregano oil burns. You have to make sure that they only use a few drops in about 4 ounces of water. Otherwise, they're going to come back to you and say, that really hurt, and I'm not going to do it again. So just be careful with that oil. Vitamin Research Products makes a product called Lectin Lock, and Lectin Lock is a product with nutrients that binds up unwanted lectins in food. And lectins are what gluten and gliadin are. So it binds them up or locks them up, and it doesn't allow them to get absorbed and processed through into the bloodstream to cause this cascade of inflammation. It binds it up and allows it to get excreted in the stool. So when patients cannot avoid eating these things, I tell them to take something like a lectin lock to blunt the effect. But I still tell them you still want to try to avoid it, but on the event you cannot avoid it, take your lectin lock with you. And they usually take 2 capsules within 30 minutes of eating an offending food, and it really does help to blunt the effect. Digestive enzymes works very, very well to help blunt the effect, and you have them take that at the onset of eating. And probiotics also help too. You want to eat foods that are organic and non-processed as much as possible. You want to maintain a lot of variety in your diet to avoid future food allergies and or intolerances. You want to have clean air, clean water, and purification systems for that. And blood type diet can be useful. I don't have a lot of knowledge about blood type diet in my own formal training, but I have been around people who have educated me about blood type dieting, and I really didn't see that it made, in my mind, a big deal. But I did have some patients that once I incorporated some blood type diet changes, they did get better. So, type A, B, and O, just kind of get maybe a general sheet of some of the main foods that they may not want to eat. So your O-type diets usually need to avoid gluten and grains and corn. And bummer for me, I'm a type O because I thought that I just needed to avoid gluten for about 30 days and I can reintroduce it and I should be fine with grains. And then lo and behold, I was told by my friend that, nope, actually you're type O, so you pretty much want to avoid those the rest of your life. And that was pretty devastating if you're used to eating those foods. But again, you try to blunt the effect and you try to not eat it as much, and that's always a good idea anyway. So here are some resources. The American Academy of Environmental Medicine has been very helpful for me. The Institute for Functional Medicine is great for learning how to do a more integrative functional medicine approach. And U.S. Biotech Laboratory was the company that I use and used in the past and still currently use if I want to do delayed IgG testing. And I use ALCAT Laboratories to do the food intolerance and chemical intolerance panels, as we talked about. And I did read Dr. Theron Randolph's book, An Alternative Approach to Allergies, and I found it quite fascinating what he did. He actually created a hospital setting where if people were sick enough in the world with their allergies, he would bring them into the hospital, find out what was wrong with them, and then eliminate their diet entirely and introduce one food at a time, one food at a time. And he made people well. These are people who were schizophrenic and psychotic and extremely ill. He got them well just by changing their diet. So I was very impressed by the power of the diet after reading that, and it's been shown time and time in my practice to be very useful. And ALCAT gave me a complimentary book called Your Hidden Food Allergies Are Making You Fat. And I haven't read through all of it. I flipped through it, but I think this would be a very good book to read. And this is where that study out of Baylor is mentioned. And this is a great book that you may want to have in stock in your office for anybody who's trying to lose weight and trying to find different avenues of underlying causes of weight gain or inappropriate weight. So this is, again, looking at hidden food allergy and intolerances that are causing a cascade of inflammation that are putting on unwanted weight. And the one thing we didn't really spend any time talking about, but putting on weight and inflammation is obviously going to stress out your adrenal glands. And if you do functional medicine, you have to address the adrenal gland health because that's going to be a major stressor. So you want to make sure that you take a look at that as well. And I think I have one more slide. I can't seem to get my little arrow to show up here. Oh, there it is. That's it. I want to thank you. If you guys have any questions about anything that we covered, I'm happy to take any questions.
Yep. Dr. Dominguez, I think before we get to everybody's questions, I just want to ask you one real quick one. And we sort of get this all the time. And it's, how do you address the ALCAT to your patients? How do you tell them that they need this test or that they may not need this test? How do you address the ALCAT test in your practice?
Well, I usually tell people that, or with the patient when I'm talking to them, I say to them, I get a history from them, and I say, it sounds to me that you have a lot of symptoms that could be related to an underlying food intolerance. And since you don't know what you have, and I can suspect that it could be a number of things, the best approach might be to do a formal testing, and then we can go ahead and adjust your diet accordingly. And I do give them the option to do an elimination diet program, but you're eliminating one food and one food and one food, and that gets very draining for the patient. And I really don't have any problems when I say that to the patient to suggest to them to do the testing.
Great. Thank you very much. What I'm going to do now is, if you have a question, please type it in the chat box or at least mention that you do have a question, and then I will unmute you so you can go ahead and ask the question yourself. It looks like the first question was from Nancy Sprouse, so I'm going to go ahead and unmute you. Nancy, you want to go ahead and ask that question?
Yes, I've been using ALCAT for about 6 months now, And we've been asking our patients to stay off the severe list for 6 months and the moderate list for 3 months, and that's almost impossible. I mean, I like better the 30 to 60 days that the doctor's talking about tonight.
Yeah,
Is there a reason?
When I went through my formal training at the American Academy of Environmental Medicine and through the Institute for Functional Medicine regarding food allergies, and they said the same thing to me. They said 6 months, and I have to tell you, I was one of the people who raised my hand. I said, you know what, that's just not going to happen in my practice. And I said, what is the minimum amount of time that would be effective? And I got the same response from 2 different people who specialize in this, and they said minimum 30 days. You need a minimum of 30 days to be effective. And so I basically took that home here. I said, look, minimum 30 days, preferentially 6 weeks, and then I want you to get in the habit of not eating this on a regular basis. And that has worked for me. It really has.
I like that.
So,
yes.
I mean, I don't have my patients walking out of here completely devastated.
Exactly, yes. I like that. Thank you.
That seems to work for me.
Okay.
Great. Thank you, Nancy. It looks like the next question is from Brian Russell, and he said, may we get at least a paper copy of this presentation? Yes, absolutely. We are going to have both the recording and the presentation slides available for download on our website in the Practitioner Services login section. If you are a new tester or a new client and you don't have a login, just call us up and we'll tell you how to get one. Or your account representative can send you both the recording and the presentation slides. So there are several ways to get it. So let's see. The next question is from Lindsay, I think it was Felt. And it's, I'm going to go ahead and unmute you real quick. Lindsay, go ahead.
Hi. Thank you so much for this. This has been really great. I was curious about the timeline that you would recommend to your patients for the 4R protocol.
Oh, to get through the 4R protocol entirely?
Yes, yes.
Okay. Well, it depends. It depends. Well, first of all, you can implement the 4R protocol the minute you start to see the patient. I oftentimes begin the 4R program at my initial consultation with the patient. So even though I'm recommending that they do the ALCAT testing, I said, your intestinal system definitely looks damaged to me based on your history, so we're going to go ahead and get you started now. And I implement every aspect of the 4R program, and I basically tell them within about 2 to 3 weeks of starting, they will significantly notice less gas, less bloating, having easier time to digest. They're going to start stooling regularly. Those kinds of things are going to start to happen. And oftentimes along the way, people start to tell me, I'm noticing that I'm not as bloated. I'm noticing that I'm not as painful. I'm not having as many headaches. My sinuses aren't acting up as much. I mean, systemically, things start to get better when you heal that gut. So usually within about 2 to 3 weeks, they can start to see the beginning benefits of it. But they may need to be on it for months, sometimes maybe 3, 4 months. It all depends on how they're doing. And if I do the comprehensive digestive stool analysis, the CDSA on them, I usually tell them that they can get started on my program, but whenever you do that testing, they ask that you don't take any supplements for 3 days ahead of time, so that whatever comes through the stool testing will be reflective of them, not the supplements. So I'll give them the stool testing, and I say, look, you can do this first thing tomorrow and then start the program right afterward. That would probably be my best advice. And oftentimes people are very motivated to get started to get well, so they'll do that.
Okay, great. Thank you.
You're welcome.
Thank you, Lindsay. Looks like the next question is from John McFarland. Give me 1 sec, and we'll get you there to ask that question. John, go ahead.
I wondered if you'd had any experience with patients with Crohn's disease.
With Crohn's? Was that Crohn's disease?
Yes.
Yes, it was Crohn's.
Yes. I actually have had some patients. I have a gastroenterologist in my neighborhood who is very open to what I do. She doesn't understand really what I do, and she has sent me a couple of ulcerative colitis and Crohn's patients. And the way I see Crohn's patients, to me, it's an autoimmune condition. So it's where the immune system is not working properly. So it's up to me to do whatever other workup has not been done yet. So I look for where the immune system went from normal to abnormal. I ask them, when did you last feel well? And if they tell me that back when they were 20 years old, they picked up a bad intestinal infection traveling, and ever since then things just got worse. And next thing you know, their doctor 5 years later tells them they have Crohn's. So the initial insult to me was that initial intestinal infection. So I check for bacterial overgrowth. I check for yeast. I check for intestinal lining inflammation. And you can get all of these on comprehensive digestive stool analysis. Another thing that's very common that I've seen with either ulcerative colitis or Crohn's is food allergies and intolerances, the common ones being milk and gluten. And I've seen that quite a bit. And when I take people off of dairy products and off of gluten, within about 30 days, they are feeling remarkably better. And they're able to cut down on their steroids. They're able to cut down on their other medication, their immunosuppressive medications. I haven't cured an ulcerative colitis or Crohn's patient yet, and I have to tell you the main reason is because they're still seeing their gastroenterologist, and their gastroenterologist is still telling them they need to be on steroids and they need to be on these other meds. But I'm able to help them get their meds down, and they're feeling a lot better.
Great. Thanks.
Sure.
John, it looks like we have another question from Aline Krieger-Fiedler, and it's, where can you obtain lectin lock?
Lectin lock is sold by Vitamin Research Products, and you can go to VRP, their initials, VRP.com. And you can mention to them my name. I mean, I've been with them for probably about 8 years or so, maybe even longer. But you can set up an account for yourself by getting the 1-800 number on the phone, and they can go ahead and set up an account with you, and you can order products, or you can get a PIN number in case you have a practice where you can't stock supplements. You can order products using, the patient can be given a prescription from them with your PIN number on it and their 1-800 number at the bottom, and the patient just calls it in, and then they can have the product directly shipped to their house, and then you actually get a check from Vitamin Research Products at the end of every month based on anybody who's ordered products through your PIN number. So it's a nice avenue if you happen to be in a practice where you are unable to carry the product. But I carry Lectin Lock here in my office.
Dr. Krieger-Fiedler, do you have any follow-up questions to that, or? Hello? Okay. All right. Looks like we have no more questions in there. I actually have one more question for you as well, though. Do you work with children with autism and food sensitivity, or have you, what's your work with autism at all?
I have worked with a couple of patients with autism. I wouldn't say that I specialize in that. I just don't have a high volume of children that come to me for that. I have, the people who I have seen, I have done some delayed food allergy testing on them. I have not done an ALCAT testing on them because they tend to be rather young, and parents are usually not too thrilled about getting a blood draw of that volume on their child. So doing a little pinprick in my office for the IgG pathways have been helpful, and I've gotten some success out of it. But there's usually some other factors going on too, and so it's not always just that, but it's definitely an important component.
Okay, great. Thank you. Looks like another question just popped up. Dr. Krieger-Fiedler, are you there to ask a question, or? No, we can't really hear you if you are. So I'll go ahead and ask the question. Could you please describe your use of oregano oil in treating sinusitis and vaginal infections again, please?
Yes. I have people purchase oregano oil at a reputable store, like over here we have Henry's or Mother's, and they add 3 to 4 drops in approximately 4 ounces of water, and they add about a teaspoon of xylitol. Xylitol, Xylitol is how you spell it, and they just shake it up, and they can either use it in a spray bottle for their sinuses, or they can actually use it literally as a vaginal douche if they have a lot of vaginitis, recurrent vaginitis, yeast infections in the private area. So and they can use it as many times as they want, but I usually tell them to use it at least 3 times a day.
Thank you. If there's any more questions, I'd love to take them. Otherwise, we'll get wrapped up here. Give it just a minute here.
Okay.
Well, I'll just, as we're waiting, I just want to let everybody know that you will be able to download this from our website, again, Practitioner Services area, and you'll also be able to get the PDF version of these slides. Oh, here we go. This comes from Lindsay Felt. Blood test and protein digestion. I'm going to unmute her real quick and have her follow up.
Okay.
Lindsay?
Hi, I was trying to type fast, so I didn't get my whole question on there. But
okay.
you had gone over some numbers that you looked for in the blood test to see how people are digesting protein.
Yes.
And I didn't quite get all of that. Would you mind going over that really quickly again?
Yes, yes. So your BUN, your blood urea nitrogen level, is a reflection of how much protein breakdown is coming into your blood. Mm-hmm. And typically if it starts dropping below 15, I get a little bit concerned that the patient's not really breaking down a lot of protein. And then their total protein, their albumin, and your albumin-globulin ratio, I take a look to see if those numbers are kind of hovering along the low normal side of the reference range. And I usually ask my patients, do you feel like you eat protein foods every single day? And if they say, yes, I do, then I'm suspicious that they're not entirely digesting and absorbing their protein.
Okay.
And usually that's a consequence of lack of hydrochloric acid and or digestive enzymes.
Okay. Great. Thank you so much.
You're welcome.
Great. Thank you, Lindsay. Looks like there's another question from Dr. Stewart. Hold on one moment. Dr. Stewart, you want to go ahead and ask your question?
Sure. Just to follow up on the vaginal treatment using the oregano oil, how long and how frequently do you recommend that therapy?
I recommend they do it 3 times a day until their symptoms go away. So it's usually, people will usually report back to me within a week's time that their symptoms went away.
Great. Thank you.
You're welcome.
Looks like there's one more question as well. This comes from Linda Ash. One second, Linda. Linda, go ahead and ask your question. Oh. All right, she might not be there. Well, the question was, how successful are you in treating rheumatoid arthritis?
Rheumatoid arthritis in general is a really good example of a condition that's very much related to food allergies and intolerances. And I learned that in my functional medicine conferences, and I was blown away because no one ever told me that when I was conventionally trained, that you need to take a look at underlying food allergies, because the antibody-antigen complexes, those immune complexes that we talked about with the different types of reactions, they get released into the bloodstream from an initial offending allergy, oftentimes food, and then they get lodged into joints, and that begins the cascade of degradation of the joints. So you definitely can help somebody with rheumatoid arthritis. It's best to get to them sooner than later, because by the time we actually see these patients, they're 15, 20 years along in their disease process, and there's already been some permanent damage. But you can definitely make some improvement and slow down the progress by addressing some underlying food allergies and intolerances.
Great, thank you. All right, well,
Welcome.
I think we're gonna wrap it up here with questions. Dr. Dominguez, if there's any way people can get in touch with you if they do have questions, could we forward some questions to you, or can we put up your contact information here? Would you mind if we did that?
Sure, no problem.
Great. We'll make sure everybody gets their contact information if you have any questions, or you can always ask us, the ALCAT Lab, if you do have questions. I want to thank everybody for coming out tonight, and I want to thank Dr. Dominguez as well. It was wonderful. We all learned a lot, I think. And yeah, thank you for coming out.
All right, thank you so much.
Great. We'll be in touch, Dr. Dominguez. Thank you very much.
Thank you so much. Okay, bye-bye.
Bye-bye.